Hello, my name is Dr. Dewan S.Raja. Today I will discuss about the pharmacology of Propofol. Market name is Diprivan. The Propofol is an intravenous sedative hypnotic used for the induction and maintenance of general anesthesia. It is highly lipid soluble and is administered as an emulsion of oil, especially soybean oil, or with egg. Mechanism of action, its exact mechanism is not known, but its possible mechanism is that it activates the chloride channel and modulates the gamma aminobutyric acid receptors. It is the antagonist of NMDA receptor, and it inhibits the cytochrome P450 system. Pharmacokinetics and pharmacodynamics onset is smooth and occurs within a few minutes, maybe within 45 seconds of intravenous administration. It is highly protein bound. Most of the propofol is rapidly metabolized in the liver. Partly it has extrahepatic metabolism. It is metabolized in the kidney. Partly causes hypotension. It also depresses CNS, and occasionally it may cause CNS excitement, dystonia, involuntary skeletal muscle movement, and hiccup. That is the contraction, involuntary contraction of the diaphragm. It decreases intracranial pressure and has bronchodilator properties. But in certain situations, is an adverse effect. It may cause cough and bronchospasm. Indications and contraindication. Indication, it is a general anesthetic. It is used in the intensive care unit, ICU, for sedation of mechanically ventilated patients, especially in patients with severe head injuries. And it's because it decreases intracranial pressure, so it is suitable for this type of patient who has severe head injuries. It is used as a management for status epilepticus, which is sometimes refractory to the benzodiazepine or anti-epileptic drug. In that situation, the propofol may be an indication, may be effective. Management of alcohol and another sedative hypnotic withdrawal syndrome like GSB. So this drug withdrawal syndrome is managed by propofol in rapid opiate detoxification protocol. It is also used there. So there are many uses. Adverse effects, pain in the injection site. So we may need to add some type of local anesthetic. We may mix local anesthetic with that of the propofol like lidocaine. It causes hypotension, bradycardia, decreased heart rate, cardiac impulse conduction disturbance, cough, myoclonus, involuntary movement, involuntary abnormal movement of the skeletal muscle, seizure-like movement, that is also possible. And another adverse effect may happen, that is propofol infusion syndrome, a condition of lactic acidosis, renal failure, rhabdomyolysis, and cardiovascular prolapse. There are reports of acute pancreatitis. Okay, there are few reports. It may be used as a substance of abuse by the person who deal in the anesthesia department. There are some reports about that also. It may discolor the urine, although it is used during C-section, but FDA gave some warning because this drug may go through the placenta may depress the central nervous system of the fetus, but still it is ignored and it is practiced. Contraindicated in history of hypersensitivity to propofol, soybean or egg. It is not approved for pediatric patients under the age of 3. Advantages: rapid onset, maybe within a minute, maybe even less than 1 minute, maybe 1 to 3 minutes. Lowers intracranial pressure, that may be helpful in a patient with severe head injury in the intensive care unit. Okay, so it has an euphoric feeling in the patient, so it is better than that of the thiopental. Useful for spinal tumor surgery because it depresses the evoked potential, somatic and CNS evoked potential. So it is useful for spinal tumor surgery or removal of the spinal tumor. It does not cause post-anesthetic nausea and vomiting. That is also an advantage. Disadvantage: it has almost no analgesic action, so we need to add some analgesic or anesthetic, other local anesthetic along with that of the propofol because it has poor analgesic action. Okay, and that's all about the pharmacology of the propofol and intravenous anesthetic. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.